MCQ. Which of the following findings is characteristic of interstitial lung disease, ILD, on high-resolution CORT, HRCT, scan of the chest? A. Ground glass opacities. B. Cavitary lesions. C. Honeycombing. D. Curly B lines. Answer C. Honeycombing. Explanation. Honeycombing, characterized by cystic air spaces surrounded by thick fibrotic walls, is a characteristic finding of fibrotic interstitial lung disease, ILD, on high-resolution CORT, HRCT, scan of the chest. Ground glass opacities are seen in various lung conditions, while cavitary lesions and curly B lines are typically associated with other pathologies such as infections and heart failure, respectively. MCQ. Which of the following is the primary pathological feature of asthma? A. Airway inflammation. B. Bronchoconstriction. C. Mucus plugging. D. Alveolar destruction. Answer A. Airway inflammation. Explanation. Airway inflammation is the primary pathological feature of asthma, leading to bronchial hyper-responsiveness and reversible airflow obstruction. Bronchoconstriction and mucus plugging are consequences of airway inflammation in asthma. Alveolar destruction is characteristic of diseases like emphysema, not asthma. Which of the following organisms is the most common cause of community-acquired pneumonia, CAP? A. Mycoplasma pneumoniae. B. Streptococcus pneumoniae. C. Haemophilus influenza. D. Legionella pneumophila. Answer B. Streptococcus pneumoniae. Explanation. Streptococcus pneumoniae is the most common cause of community-acquired pneumonia, CAP, particularly in adults. Mycoplasma pneumoniae is a common cause in younger adults and adolescents, while Haemophilus influenza is more commonly associated with chronic lung disease. Legionella pneumophila is a cause of severe CAP, particularly in outbreaks or in immunocompromised individuals. Which of the following is a characteristic feature of sarcoidosis? A. Non-CA seating granulomas. B. Honeycombing on chest X-ray. C. Asbestos exposure. D. Occupational lung disease. Answer A. Non-CA seating granulomas. Explanation. Sarcoidosis is characterized by the presence of non-CA seating granulomas, which can affect multiple organs including the lungs, lymph nodes, skin, and eyes. Honeycombing on chest X-ray is more suggestive of idiopathic pulmonary fibrosis, IPF, or other interstitial lung diseases. Asbestos exposure and occupational lung diseases are associated with conditions like asbestosis and coalworkers' pneumoconiosis, respectively. Which of the following is a common symptom of pulmonary embolism? Pair. A. Pleuritic chest pain. B. Wheezing. C. Prolonged cough. D. Bradycardia. Answer A. Pleuritic chest pain. Explanation. Pleuritic chest pain, often worsened by deep breathing or coughing, is a common symptom of pulmonary embolism, PER, due to irritation of the pleura by the embolus. Wheezing and prolonged cough are more commonly associated with conditions like asthma and chronic obstructive pulmonary disease, COPD. Bradycardia is not a typical finding in PER. Tachycardia is more common due to sympathetic activation. MCQ. Which of the following diagnostic tests is most useful for confirming the diagnosis of cystic fibrosis, CF? A. Sweat chloride test. B. Chest X-ray. C. Pulmonary function test. D. High-resolution CORT, HRCT, scan. Answer A. Sweat chloride test. Explanation. The sweat chloride test is the most useful diagnostic test for confirming the diagnosis of cystic fibrosis, CF. Elevated sweat chloride levels, greater than 60 MEq/L, are characteristic of CF, while chest X-ray, pulmonary function tests, and HRCT scans may show characteristic findings in CF. They are not specific diagnostic tests for the condition.